Good afternoon, folks, and welcome. My name is Gupta, and I'm the health officer here at Charleston Health Department. I want to start with thanking you all for coming, and I want to especially thank the honorable members from, first of all, the Honorable Senator Rockefeller to be here, as well as the HRSA Administrator, Dr. Wakefield, to be here, members of the West Virginia Legislature, the Insurance Commissioner, as well as members of the Department of Health and Human Resources. I also want to thank the West Virginians for Affordable Healthcare for organizing this event. I want to start by mentioning why we're gathered here today. 1 year ago today, President Obama signed into law the landmark health care reform legislation. We're here today to reaffirm our support for the Patient Protection and Affordable Care Act field workers. I want to introduce to you Senator Rockefeller.
Oh, this is a nice screen. Do I have to put on something so I can be heard?
I think that's good.
You can hear? Oh, right here.
Yeah.
Oh, that's clever. It's really a wonderful day. It's raining, of course, and we're going to get hail and thunderstorms and things of that sort, and probably some snow and sleet, but it's a wonderful day because it's the anniversary, first anniversary of probably the largest societal change in America as long as I can remember. Now, does it put it up there with Social Security and Medicare? Well, it protects Medicare, and it protects Medicare beneficiaries. Social Security is safe on its own. It's not, this bill doesn't have to protect Social Security. Social Security protects Social Security itself. And it does a very good job at that. But what makes me so happy is that the West Virginia Health Reform Coalition, Dr. Mary Wakefield, Dr. Gupta just spoke, Senator Foster, a good doctor, and all of the people, because I can't, Kenny, I mean, I should recognize you, all kinds of people I should recognize, but I'm not going to, because people have to speak and need to speak who have their own stories to tell. But let's just say that this has been a real act of faith and belief in the goodness and the willingness of the West Virginia people and the American people to come around to believe that what has been done is an enormous advantage to them. And that will not come easily. It still hasn't come entirely. But the mood is beginning to change as benefits begin to kick in. And that's human nature. When people discover that something that has just been passed in Washington, which has been through a meat grinder of scrutiny for 2 years, and I've really participated very heavily in that, and I was sometimes the grinder and sometimes I was the meat. But that didn't make any difference. So we sort of pushed forward and always believing that what we were doing was right, and to not do it was wrong. And I never could figure out, and I still can't figure out, why it is that people who want to get rid of all of this figure that we're doing people a favor. You know, we say there are 33 million people uninsured. Actually, it's closer to 45, and there are probably another 25 who are underinsured. It doesn't do them a favor to say, no, we're not going to do this. We're not going to enforce this bill. We're not going to let it come into being because we want to go back to our old system. So it already is making a difference. But let's face it. Let's not worry moment to moment if people are not accepting it fulsomely, because they're not going to, because they got pretty much, for most of the media and a lot of, no, most of the media and a lot of speeches, they got the negative. And the negative often was not true, but people often believe what they hear, and if it's repeated often enough, they come to believe it. So it's our job to go ahead calmly, sensibly, responsibly, to see that these measures are put into place in a way which really does help people. I think West Virginia is fantastically blessed by committed people. We're not a huge state, but when you get an issue like this, there are all kinds of groups and activist people and physicians and nurses. Today we're going to hear from a man whose son was working, but was uninsured, and he can now stay on his parents' health insurance until he's 26 years old. I cannot tell you how many people write and talk to me about that one small piece of the bill. They don't have to worry. They don't have to worry. They can go through college, they can go through graduate school, they don't have to go through either of those, but they know they're going to have health insurance from one of their parents or both their parents until they're 26 years old, when they're pretty well launched in life. One of the things that's always amazed me is how little the small business help is not understood, Perry, in this bill. I mean, it's so clear that starting, several months ago, small businesses who didn't have the money or to insure their employees, but who want to, get a 35% tax credit. Get a 35% tax credit. The government will pay for 35% of their health care, should they choose to provide it. In 2014, the government will pay for up to 50% of their health care costs, should they choose to provide it. That is so wonderful, because small business is always held up as what is in peril, but is basic to America, and here we are actually giving them very, very direct help. Because of the health care law we're talking about today, insurance companies cannot deny coverage for children with pre-existing conditions, period. So that's already in effect. And in 2014, it'll be totally in effect for all adults. I've spoken with Shonda from South Charleston. Her 4-year-old son faces many serious stomach problems. Shonda's been able to get coverage for her son's medical needs through something called Medicaid. 1/2 of all the babies born in West Virginia are born under Medicaid. So we better make up our mind pretty quickly whether we only like people who aren't born under Medicaid because maybe they have a little bit more money, or that we're all God's children and some are more blessed than others financially, and if Medicaid can deliver a child, it's 40% nationally, if it's 50% in West Virginia, that's a blessing. But I will say that I don't think there's any state in America that stands to gain more or lose more in the passing of or the failing of this bill. So that you're here with righteousness. You're here with just cause. You're here to fight for the right thing. And there's just nothing more wonderful, Mary, than being in the company of people who are fighting hard, always uphill in West Virginia, but fighting for the right cause. So I want to thank all of you very, very much for what you've done, and I will sit down.